ADHD is a frequently diagnosed mental disorder among today's children. According to the Centers of Disease Control and Prevention, 5.4 million school-aged children have been diagnosed with ADHD. Symptoms of ADHD are often confused with normal behavior, and therefore, as the number of ADHD cases rise, so does the number of children misdiagnosed with the disease. But what exactly is ADHD? Dr. William Winter, child and adolescent psychologist, explains.
I've been hearing a lot over the past few years about ADHD. So what is that really?
ADHD stands for Attention Deficit Hyperactivity Disorder. So what we really see are problems with inattention, hyperactivity, and impulsivity. We don't find any physical problems per se.
How can you differentiate between normal misbehavior in children and ADHD?
The child with ADHD is that 1 in 20 who is squirming in a seat or getting up out of a seat when he's expected to stay in it. Or it could even be a child who doesn't have a hyperactive component, what we used to call ADD. That's a child who actually doesn't have any problems with behavior. He or she just sort of flies under the radar. And so what happens is, unfortunately, years can go by when the child is just not performing up to their potential.
Inattention can include behaviors such as difficulty paying attention to details, a tendency to make careless mistakes, easily distracted by irrelevant stimuli, inability to concentrate on activities, procrastination, and not listening to others or to individuals in a position of authority. Hyperactivity is the most commonly recognized symptom of ADHD. This may include fidgeting when seated, getting up frequently to walk or run around, running or climbing excessively, difficulty playing quietly, and talking excessively when it is inappropriate. Impulsivity is also very common in children with ADHD. Signs of impatience, delayed responses, and blurting out answers before questions are completely asked. Impulsivity can lead to accidents and engaging in activities which may be dangerous without consideration of the consequences of their actions. Reflecting on history of ADHD, the disorder was first identified in 1902 and was initially believed to be a form of brain damage. Currently, the exact cause of ADHD is still unknown, but factors such as size and density of the brain structures as well as the chemical reactions occurring in a child's brain are believed to contribute to ADHD symptoms and behaviors. Let's return to Dr. Winter to further explain how a diagnosis of ADHD is achieved, as well as potential treatment of ADHD.
Diagnosis is with a psychiatric evaluation. We get input from the parents, from teachers, from babysitters. Collateral sources are very, very useful in that evaluation as well.
So how do you treat ADHD?
Therapy is helpful for treatment. Changing the child's environment, if we can, is helpful. We work with the parents. They need to be educated, directed, supported. We work together with the teacher, the child psychiatrist, and the child. It's not a job for the child alone. And then finally, medication.
As Dr. Winter explained, appropriate diagnosis is important in determining whether a child has ADHD or not. Between 2003 and 2007, the Centers of Disease Control and Prevention reported that self-diagnosed cases of ADHD by parents of children showing possible symptoms increased by 22%. In turn, this has led some medical practitioners to take the symptoms to face value and therefore diagnose thousands of children with ADHD incorrectly. Accurate diagnosis is important for two reasons. First, children diagnosed with ADHD are sometimes labeled as children with behavioral issues by their family, friends, and schools. Some children's self-esteem and confidence has been affected by this as they begin to believe they have something wrong with them that separates them from the rest of their peers. Second, ADHD is treated with medications such as Ritalin, Adderall, Vyvanse, Strattera, and other medications. These are controlled substances that are strictly regulated. Teens and young adults who abuse ADHD medications for their stimulatory effects are at risk for side effects that can include irregular heartbeat, difficulty breathing, seizures, and mood disorders. Constant and repeated use of these drugs can cause strokes, confusion, hallucinations, delusional behavior, and paranoia. ADHD is a treatable disorder, but it and the appropriate course of treatment must be taken seriously. If you suspect your child has ADHD, be sure to have him or her diagnosed by a licensed professional. Help and information is also available online at www.nimh.nih.gov.